What causes preterm labour? So this is labour before 37 weeks, and we don't always know why preterm labour happens. Many labours occur spontaneously with no clear cause, but there are often some contributing factors that can impact on the risk. Most of them are out of your control, but some of them are modifiable. So let's look at them. If you've had a baby early before, or have had a late miscarriage, then this can increase your risk of having a preterm birth in a subsequent pregnancy. Weakness or damage to the cervix can lead to cervical insufficiency or a shorter cervix in your next pregnancy. This means that the cervix may shorten or open early. If you've had a prior surgery to your cervix, like a LETS procedure or a cone biopsy, or if you've had a previous cesarean section at the end of labour when you're fully dilated, then that can be a risk factor because there may be damage to the cervix from the cesarean section. If you're pregnant with twins or triplets or more, then the more babies you have in your womb, the greater the strain on the uterus and on the membranes, and that can trigger earlier labour. Problems with your placenta? Well, if you've got a condition such as placenta previa, for example, where the placenta is low or covering the cervix, or if your placenta starts to come away from the womb earlier, which is called placental abruption, if you've got placental insufficiency, where there may be growth problems, where the placenta is not working as well as it should do, then that can trigger early labour as well. If you've got too much fluid, so polyhydramnios, that is where you've got too much amniotic fluid floating around the baby, and that can cause an overstretch of the womb, and that can trigger labour as well. Maternal infections such as urinary tract infections, genital infections such as chlamydia or gonorrhea, or a systemic infection such as flu, that can also be a risk factor for triggering early labour. Bleeding in pregnancy can also increase that risk, especially if you're bleeding after 24 weeks of pregnancy. Sometimes that can be because there's an issue with the placenta, or sometimes bleeding can just create an environment for infection or inflammation, and that can also trigger preterm labour. There are some things with your lifestyle and health that can also have an impact. So if you're a smoker, that can trigger early labour. If you've got unmanaged conditions like diabetes or poor nutrition or other health factors, those can sometimes have an impact. So those are things that you can work towards optimizing your own health and well-being, and stopping smoking if you can as well can help to reduce those risks.